Hello everyone, welcome to the course Disability Studies in India, Historical, Social and Cultural Perspectives. So in this module, we are talking about how to implement policies in terms of people with disability, which means that the kind of policies that we have, how they were implemented, we will all be discussing that as well, and how we are going to frame new policies in relation to people with disabilities, right? So this entire module is nothing but about social policies and disability, right? In the previous lecture, I was talking about what are the major areas where one has to work on implementing the social policies, right? Let's say, for example, I discussed education. Like we all know, education is extremely significant, important area because until and unless one is educated, they cannot be included in the society. So before I go to the next one, I'll let you know that why are we talking about it, right? Because exclusion is not good. Anyone, we are living in a society. So when we live in a society, everyone has right to live with dignity, with equal space, with proper rights, right? And if suppose for some reason you are excluding someone, that's not good, right? On the basis of caste, culture, religion, color, cloth, cuisine, you name any categorization, if you make it, and if you say that no, this is the particular reason you are being discriminated, that's not a valid ground. And so we have discussed this when we theorize disability, we discuss about all those politics. So that is why we are looking at what are the important areas where we can work on, where we can improve social policies so that people can be included, right? That's simple. So education becomes one of the important core area where one has to work on so that people with disabilities can get opportunities to be educated and therefore they can they can come into the mainstream society. That's important concern that I have. All right. So that's why education is important. Second one is health. Right? Everyone's health is important. Right? Don't it's not that someone's health is more important than others. That's not true. Everyone has the right to have a good health. So we need to work on health as well, right? Then we also talked about social securities, right? It's important. His or her people with disabilities securities is also important. What are the measures that they're supposed to take for their holistic development? All right. So employment opportunities, that's also important. After education, they have to go for employments, and we also discussed that it's not that only public institution should take care of employment opportunities, but also private institution, they must also take care of opportunities, employment opportunities for people with disabilities. So keeping this in mind, what we thought of, right, why we did discuss it, like whenever you are reading something, when you are listening something, you should ask why are we talking about it. So when we discuss these four areas, we also discussed that what are the challenges that we may face. Like obviously, you are taking about a lot of measures in terms of policies. If we do this, if we do that, people will be included. That's fine, nice idea, right? In the issue rooms being planned, but the problem is implementation on the ground level, right? Who is going to implement? What are the challenges that we are going to face? So one important challenge that we saw, that obviously social prejudices and biases against people with disabilities. So let's say, for example, if you still believe, which we have widely discussed, that medical model, that people are less efficient, they are not capable of, right? They are not capable of, they are less efficient because of the kind of a body they have. Obviously, you will not give them opportunity because you're biased, you think they're not efficient. However, as I discussed in one of my lectures, that we hardly see the experience. We don't have experience working with people with disabilities, but we presume. That's not true. That's not proper. So, having said this, right? Having said this, the second concern that we have is working on these biases and prejudices. So, when we are talking about these lectures, so what I'm talking about more statistics. I'm talking about important policies that we have, important movements that people took to aware society in terms of people with disabilities, and also the policies. So, these are the things which I am discussing in relation to people with disabilities, right? But so far, when we understood that medical model talks about deficiency in terms of individual capacities, then we have a social model which says that no, one has to work on environment, because environment is a major barrier. Environment restrict the access of people with disabilities. It doesn't let them have opportunity to be visible in public spaces. But despite that, there are other challenges. That how are we going to work on those challenges, right? Until and unless we find out the challenges that we are going to face, we won't be able to implement. Let me give you an example. For example, we all believe in that people with disabilities must get proper education. Fine. So we also made these policies, all also legitimized, legally endorsed, passed in the parliament, given the directive to all the officials that you have to include people with disabilities in terms of education, let's say. Okay, that's great. But the challenges, you do not look at the challenges that many people have. First, funding. How will they get the proper funding? Because they have to use the ramp, they have to use the lift, they have to bring out the braille, so on and so forth. And if you don't have a funding, obviously, it's only on the paper. Right? You can show the papers, but actual reality is going to be very, very different. Second challenge that we have, let's say for example, you got braille and you say that, wow, I have a infrastructure which is accessible to people with disabilities. But did you include the hearing impaired people? Right? Because you remember there are n number of categorization when it comes to people with disabilities, right? There are people who do not identify themselves despite they're impaired as a disabled. So first is that we need to figure this out. What are the categories of disability we have? What are the forms of disability we have? How are we going to bring them together? What are the challenges they are going to face? All right, what are the challenges they are going to face? And until and unless we work on those challenges, we won't be able to implement that. So that is why we have to think about challenges in implementing disability policies, because as I told you that this identity, if I say so, disability identity is very, very complex. It's not as easy as it looks. You got this idea? So that's why one has to be very carefully examine the challenges that we are going to face in implementing disability policies, right? So, in my lecture, what I'm going to do, I'm going to highlight some key areas, some key points where we see that there are challenges and one has to work on those challenges, right? So, there are key areas, but as I have already said that every lecture has a limitations. I cannot cover all the areas and I may miss something. But as a researcher, as a student, it's your job to figure this out. What are the challenges? Like, that's why I discussed this very late. Like this module, if you see that, I'm discussing after I have discussed a lot of other issues because intersectionalities. For example, the policies and the challenges that a man with disabilities face may not be the same for women with disabilities, right? So you may say so that there are systems available, there are things available, but you have to think about the intersectionalities, about how multiple different entities intersect with each other, and then for them there are new challenge, there are a fresh challenge for them. Like let's say for example, upper class men with disability and lower class men with disability, for these two people, challenges are not going to be the same. Like there is a one class, maybe they are suppose educationally advanced, they know what are the facilities are available, what are the policies have been formed, what are the institutions that are available for them, right? So they will easily enjoy those opportunities. But for lower class or let's say poverty stricken people, there are multiple challenges. Maybe first, I personally feel so, and I have noticed to a large extent, awareness is a problem, right? Awareness is a problem. They are not aware about the policies that they have. They don't know how many important policies they have. So how do you think they will get benefited? So you have to also bring the awareness campaign. So for example, financial inclusion is not easy for poor people because they don't know what are the facilities are available, what are the documents are required to be financially included. You getting my point? So there is a multiple challenges, depends on the kind of disability they have and the kind of identities are intersected with disability, like poor people, women and disabled, different problems. Even in disability, hearing impaired, visually impaired, physically impaired, cognitively impaired, right? So cognitively will take another dimension altogether, right? It's not easy. So therefore, it requires very engaging, exhausting brainstorming to reach to a point, to reach to a conclusion, to understand the challenges that they face and the problem. All right. So let's look at the first slide, please. At the first slide, if you see, I'm talking about very important, which I was discussing, in fact, is cultural and stigmatization and cultural barriers. So first one is stigmatization. I already have discussed this, right? So social attitudes toward disability are often shaped by stigma and misunderstanding, right? So there is a possibility that they have a problem in terms of social attitudes, right? So because of that social attitudes, which I was discussing, due to the stigma, due to the misunderstanding, it can hinder policy effectiveness. So in many cultures, disability is viewed through the lens of a pity, which undermines the potential for empowerment-oriented policies, right? Resource constraints, especially in low and middle income countries, social policies is limited by inadequate funding and lack of infrastructure. So limited budget often mean that disability-related policies are underfunded or prioritized lower than other public services, right? Policy fragmentation, disability policy is often fragmented across various agencies, right, leading to inconsistent support and services. So without a coordinated approach, right, that's what I was trying to refer. People may struggle, individual may struggle to navigate complex system to access the resources they need. and lack of data and research. Effective policies requires reliable data on the population. It serves, however, data on disability demographics and needs are often limited, particularly in low resources setting. This lack of data can lead to misinformed policies that fail to address actual needs, right? So let's pick one by one and then talk about it, right? So let's say, for example, one is I'm talking about stigmatization and cultural barriers. So I have discussed this to a certain length, that stigmatization is obviously one, and that's why you also noticed in few of my lectures I have extensively talked about stigmatization, and that is why you see I have put stigmatization and cultural barriers on the top, the first challenge, right? I did not put funding, like upper data, policy implementation or fragmentation on first level. I have kept cultural barriers, stigmatization on the top, because trust me, once we are able to fight against this, our 90% problem are resolved there and then and there. You got it? So think about it, and obviously as I move forward, this will keep coming up, right? Stigmatization, cultural barriers, cultural attitudes, so on and so forth, because they are one of the prominent challenge that people with disabilities are facing. Still, we have got the social model, but still people are stick to medical model. They still believe in medical model, right? So I'm not saying that social model is perfect, because I myself discussed the limitations of social model, right? But the point what I'm talking about, that they are not moving beyond. They are not moving beyond from the medical model. So that's a one problem that we have. Second one is talking about resource constraints, right? Resource constraints. Let's say, for example, you have 100 rupees, for example, right? The country's economy is only 100 rupees. So they will allocate the funds according to that basis, right? This much, that much will go that place, this much go that place. So if you don't have enough proper funds, you won't be able to implement the policies, despite the fact you have a wonderful vision. And the second problem that I was talking about, policy fragmentation, that's very important, because I have seen this, I have noticed this in many institutions, that it depends on the officials what they feel is important. For them, maybe some section of community is not significant, and in that case they will not be funded, they will not be given enough money, right? So it depends on also the officials, how are they going to decide which one is important, which one is less important, right? I'm sure that you can see around and you can find this out, how people prioritize, right? And that's why we have to fight on the multiple levels, not only changing the social and cultural attitudes, but as well as telling the people that no, this is also priority. You got the idea, right? So this is another problem that we have, is a policy fragmentation. So what they will do, where they will allocate, no, this is very important, one has to do this. So people with disabilities, less number, you have only 5 people, it's okay, let it be, but we have to take care of the 95 people which are in majority. So we have to first fund them, and then we have to think, if there is a fund available, then we'll allocate for people with disabilities, right? So this is the second significant challenge that we have. And then we have a lack of data and research. The fourth important challenge that we are encountering. Lack of data, what does this mean? It depends how do you collect data. Let's say, for example, I will give you just simple example. So when people go for census, right, and try to find out the population in terms of a lot of things are decided on the basis of census. So I'm not getting into the politics of census, but trust me, census was started by the Britishers. Census was not the old phenomena. It was a very new phenomena, because once you have a census, you can know the term, like lot of things you can know, the number of women, the number of men, the number of one caste, one culture, one religion, so on and so forth, you can know that. And then obviously how many people are educated and not educated, what the people are looking for, everything. Census is a very important thing, and that's why when there is a census, people talk a lot about it, right? It's always a discussion. So, I mean, I don't want to go into the talk about why British people started it. It was the British policy census started. So they started it, and there is another politics. Let's not go back. And just talking about that, there is a lack of data available. Data available means how do you, let me put it this way, how do you identify or define someone as disabled? Like, let's say for example, when you look at someone, how do you think that he's either he's disabled or he's not disabled? Because you are looking for some limbs which he does not have or she does not have. So the moment you see that he does not have a hand, you reach to the conclusion that okay, he is a disabled one. If he is properly sitting to like sitting comfortably, then you will think okay, no, he is not disabled, he is so-called normal, right? Or let's say for example, you are not able to see some parts of the body. Let's say if I am sitting on the chair, you cannot see my legs, right? You can't see my legs, and so I'm not sure whether how you consider me, whether you consider me able or you consider me disabled, right? So let's say for example, you are presuming that I may have two legs, right? You may presume that I may have two legs, but what if I may not have? Then suddenly your attitudes will change. Suddenly your way of looking at me will immediately take a new shift, new idea. So the point is also I'm talking about that when you go to the public places, right, they also get the pity attitude, like not the very respectful attitudes. Even if they are becoming part of your classrooms, you have to change the attitudes first. What if they have come over there, but the students are not aware about, they are not sensitive towards people with disability, and they are like there is a violence going on them, on those bodies. There are mistreatment, there are discrimination. So it has a multiple challenges. So you have to work on those as well. So to have a better framework, better understanding, and obviously inclusion is only possible when we work on these things, right? So lack of data is one of the significant challenge that we have, right? Whether we have a proper available data for them or we do not have. Let's say for example, even if you go and let's say, how do you do that? Suppose you come to my house and you say that, do you have a disabled child, right? I will obviously say no, because I don't want people to know that I have a disabled child, because people look at disabled child as a stigmatized, with a stigma, right? So how would you see that? How would you identify that? What is the data available? Like, think about these things to understand. All right, let's go to the next slide, please. Now let me talk about the pathways for more inclusive social policies. Right? These are like, first what I talked about four, for me, I mean again I am saying that this is what I could brought before you. I talked about important challenges, the four challenges that we discussed. Now I mean there may be more, as I told you that you have to figure this out, you have to discuss, you have to research more on it. Pathways for more inclusive social policies. So adopting a holistic and integrated approach, that's the first thing, right? So as I have discussed, disability intersects with various areas of life, and policies should reflect these complexities. So government should consider integrated frameworks that address education, employment, healthcare, and social security, right? These are the four. Collectively, there may be more frameworks, but right now I have just identified the four important frameworks, right? So by adopting a cross-sectoral approach, policies can be more responsive to the lived experiences of disabled individuals, right? Policies can be more responsive to the lived experiences. So encouraging stakeholders' participation. So disabled people and their advocates should be active participants in social making processes. Engaging people with disabilities ensures that policies are reflective of their needs and priorities, right? Like disabled people and their advocates should be active participants in policy making process. So this should not go bench back, right? So engaging people with disability ensures that policies are reflective of their needs and priorities. In addition to that, what we have, inclusive policies. It must focus on rights and empowerment, right? Focus on rights and empowerment rather than mere accommodation. Right? So, I have discussed, so I will not talk in detail about it. I'm just letting you know that these are the 4 challenges which you are going to work on. And when you're making policies, make sure that first, these complexities that we have in the life of people with disabilities and these intersectionalities, identities getting merged and then posing a new challenge, they must be reflected. They must be reflected in your vision. Then only you can reach to a better point. Then you can only reach to a good judgment. And as I also suggested that disabled people should come forward in decision making process because they experience more than anyone else. So they should tell more often what they need, what they don't need. All right. In addition to that, what we also notice that if you are not able to include, first thing you should include, and say for example, if you cannot take them to multiple places and there is some problems, then you can at least take their experience, life experience. That's also important for them, so that they can feel that the policies are made with their consent, with their choices, and they have participated that as well. And obviously it would really bring a positive effect on the policy framing and the vision of policies. Let's go to the next slide, please. And then we have in the next slide, I'm talking about improving data collection and research. Like you have to improve that. So government and organization should invest in data collection to better understand the need of disabled individuals and measure the impact of policies. So this can help identify gaps, inform decision making, and create more targeted interventions. So we have to increase public awareness, reducing stigma. The social policies need to be accompanied by public awareness campaigns that challenges stereotypes and promote a more inclusive society. Education awareness, like education as well as awareness that can help shift public perception, reduce stigma, and create a more supportive environment for policy implementation. So this advances in assistive technologies, it provides new opportunities for inclusion, and policies that promote the adoption and development of assistive technologies. This is another focus that I have brought here. I have already talked this, but this one was missing, so I just included that. So this one you have to also take note of it, that how it provides new opportunities for inclusion. Policies that promote the adoption and development of assistive technologies can significantly improve accessibility in education, workplace, and public spaces. So to conclude my lecture, I would like to say that these are the important challenges that we have in implementing disability policies. And moving ahead, I also told that how we have to look at fresh, giving new perspectives in implementation of the policies, because society constantly evolves and we have to also see the changes that we can. So we have to notice the changes and then talk about how we can bring new thinking, new vision to that. All right. So with this, I would like to end my lecture. Thank you so much for your patient listening. See you next time. Take care. Bye-bye.